All right. Thank you, everyone, for joining us today. Good afternoon, good morning, wherever you are. This is Lydia with CTeL, and we're excited to share with you our year in review, some ongoing policy updates that we're keeping an eye on, as well as what we can look forward to in 2025. So let's first get started by looking at our year in some numbers. So one of the big stories from recently is that the DEA telemedicine prescribing flexibilities have been extended for an additional year. This is something that we as a community really rallied around. And after receiving some intel that this was going to be expired, we really came together. We learned a lot about this issue, sent a lot of letters, had a lot of meetings, and really made it known how important these flexibilities are to maintaining continuity of care as well as quality of care. And so this is something that we're not quite out of the woods yet on. Because this is only a year extension, we're going to be working very closely with the incoming DEA to come to a more permanent solution that meets the needs of the healthcare field and the patients. We are also currently sponsoring research by our research fellows to help provide some more data on this to share with the DEA and other agencies to help them make informed policy on this issue. Another big story that is happening as we're speaking right now is an extension of the Medicare telehealth reimbursement flexibilities. As I'm sure we all know, the current funding for the federal government is set to expire on Friday. And so Congress is very busy working on putting together a continuing resolution to keep the government funded. But alongside that, there's a pretty sizable health package, as well as some funding for disaster relief from disasters over the past year. And one of the big ones is a 2-year extension of these Medicare telehealth reimbursement flexibilities. We were originally expecting this to be only a 90-day alongside the rest of the CR. And the rest of the CR, the general government funding, is for another 90 days into March. However, in this legislative package is a 2-year extension of these flexibilities. Also included are some reforms to pharmacy benefit managers, as well as an extension of the hospital at home program and an offset of the physician payment cuts that were scheduled to go in effect starting next year. This, we've only just today gotten the text of this bill. It still has to go through both the House and Senate and get the president's signature. So we're still very much getting started on this. And like most things with Congress, it's going to come down to the wire, and we probably won't get a final answer on this bill until it actually passes. And so I would say nothing here is guaranteed yet. There's still some changes that could happen. A lot of members of the Republican caucus, especially in the House, have expressed opposition over this bill and a lot of the funding provisions including in it. And so this is likely something that would also have to pass with support of the Democratic caucus, as with previous government funding bills that we've seen from the 118th Congress. But this is a really exciting development, and a 2-year extension would help pave the path towards permanency. And so we're really hoping that this makes it across the finish line. Another, as the 119th Congress comes together, we're also seeing how key committees that are relevant to our work are being formed. And so we've seen a lot of leadership elections, both in terms of caucus leadership and committee leadership. And so on the screen now is a list of the upcoming committee chairs for the 119th Congress. Key committees that are relevant to digital health include appropriations and budget, as well as energy and commerce, which handles a lot of the health legislation, and the Ways and Means, which handles a lot of the tax and funding legislation as well. And so we will be working alongside with our efforts to build relationships with administration leadership. We will be doing the same with these committee chairs as well, especially in the House, because that's where a lot of the funding and spending bills originate from the House. And so it's important to get ahead of that there. Another piece to note is that there are 10 new Republican members of the House Energy and Commerce Committee. This is a lot of turnover, which also presents both challenges and opportunities. Challenges in that we will have to make sure that we educate these members and their staff on the importance of telehealth, RPM, AI, and other digital health technologies, dispelling a lot of common myths and misunderstandings about digital health, such as its impact on the budget and other factors. But because there's so many new members joining the committee, this is also an opportunity to really make an impact on this issue and to build solid relationships that we can look forward to maintaining over the coming years. Another big thing is with the incoming new administration, there are thousands of appointments that administration leadership will be making. Pictured on this slide is what's commonly referred to as the Plum Book, which is a document detailing all the administrative appointments that any new administration would have to make. And so we've been involved in this process. CTeL recently sent a letter to the incoming presidential administration transition team, highlighting our priorities, as well as actively having conversations with folks to see who is getting into these positions and how we can play a role in helping facilitate and make sure that we have experts who can hit the ground running on these issues. On the CTeL side of things, we've had 9 working groups that we've had a lot of meetings over the past year. We've seen a lot of experts and had a lot of really great discussions on the issues. You may have also seen that we are updating our working group model for the coming year to kind of consolidate these into one working group meeting a month and having each working group focus on our 3 main policy verticals: telehealth, remote monitoring, and AI. And so these will be an opportunity to really condense a lot of this material into one more meeting, or I guess one meeting on the calendar, and make it also worth everyone's time as well. So we hope to see you all in the coming year through our monthly working group meetings, and we will continue to have experts and rich discussions in these meetings as well. CTeL has also facilitated over 50 congressional meetings with CTeL members and their members of Congress. We had 2 key advocacy days. In April, we held a Connect for Health virtual advocacy day, advocating for the Connect Act. And then a few months later, we had a Hill Day during our Spring Digital Health Summit, which was in person on the Hill. And both those opportunities were a great way for CTeL members to get to know their members, as well as talk about the issue of telehealth, digital and other digital health technologies, and their impact on their district as well. So we're really happy with the progress we've made on that, and we look forward to continue facilitating that for our members as well. We've also launched our regional chapters with 3 main regional chapters: our CTeL West chapter, CTeL East chapter, and CTeL South chapter. These are opportunities for members to get involved on policies and issues at the state and regional level, things like licensure, reimbursement, parity, enrollment, and other issues. And so we will continue to build out those chapters, really hone in on our issue areas, and develop our work items and deliverables as well over the coming year. And so we really hope that you will join us for that as we launch this core part of our strategy as well. And so also over the course of the past year, there were a lot of regulations a lot of really technical documents and policy changes that came out. And we at CTeL were along with you all the way. One of the big ones, of course, is the physician fee schedule, a yearly piece of regulation that sets a lot of Medicare reimbursement policies. This past year, we saw a lot to do with digital health, including updates to audio-only eligibility for telehealth services, new telehealth codes, new payments for digital mental health treatment devices, waivers for in-person visit requirements for mental health services, and much more. We've released numerous documents detailing a summary of both the proposed and final rules, and CTeL also authored a comment letter on the proposed rule, which the agency responded to many of our comments directly on as well. You can see a summary of CMS's response to CTeL's comments in the final rule summary document that we have shared as well. Other key regulations that came out over the past year include the regulations regarding the Mental Health Parity and Addiction Equity Act, as well as regulations regarding information blocking, which we've produced fact sheets and issue briefs on both of those. And we also held a working group meeting of our privacy and security working group back in August, where we had an expert from Greenberg and Traurig talk more about information blocking and how you can stay ahead when it comes to compliance. We also helped a lot of our members address some of the challenges to integrating high-quality digital healthcare. We created a number of fact sheets and issue briefs on some of these issues, a lot having to do with reimbursement, helping you understand key issues surrounding this. And we will continue to develop these kind of materials to help you make the most of your investments in digital health technology. We also had a lot of opportunities to make our voices heard over the past year. And so the next few slides are just a few of the letters and actions that we've taken, including advocating for new telehealth policy at the state level, modeling off of the successes of that of Washington State. We've also sent letters to key Senate leadership about the importance of extending the DEA telemedicine prescribing waivers. We sent letters to both the incoming presidential transition team as well as the incoming congressional leadership team, highlighting both our regulatory and legislative priorities for the coming year. We've also written letters to directly to the DEA on the telemedicine prescribing issue, as well as the aforementioned comment letter on the physician fee schedule proposed rule. And lastly, CTeL also saw some action in the newspaper as part of our efforts to get the word out about the DEA telemedicine prescribing waivers. We also spoke with journalists at the Wall Street Journal and helped them write an article highlighting the importance of this issue. We also completed and have started some much more research over the past year as well. We published 3 research reports on prescribing of controlled substances via telehealth, informed consent for telehealth services, as well as telehealth parity for private payers. And these were all 50-state surveys to really help us, as well as our members, understand what the policy landscape looks like at the state level. These are not only helpful in terms of ensuring compliance as well as making business decisions, but they also help us on a policy front to help us understand where the gaps are across different states and how we can promote the best digital health policy across the country. And lastly, the CTeL community came together and accomplished a lot of really great things over the past year. We held 3 summits, 2 in person and 1 virtual, our RPM summit. We had over 50 speakers across these summits, many of whom engaged with CTeL for the first time over the past year due to a lot of the great work from my fellow staff on this. We've had over 300 people attend these summits and conferences. We've held a number of educational webinars outside of these summits, again, bringing in experts and expanding our knowledge on key issues in digital health. And over the past year, we've held 46 working group meetings on those 9 different topics that we shared earlier. And of course, we will continue this work into the next year. And we encourage you to save the date for the Spring Digital Health Summit, which will be held on June 11th and 12th back in Washington, D.C. as well. And of course, save the date for our upcoming AI Tech Showcase, also on the Hill, which we are planning to have on March 12th. We also launched a number of key initiatives, one of which was the Emergency Department Teledental Pilot Program. This is something we're really excited about to demonstrate the potential of telehealth, specifically in the realm of teledentistry. And so the goal of this is to partner with forward-thinking institutions to really explore the cost-saving potential and improve patient care pathways that incorporating teledentistry into ERs can provide. Another big update from this past year was the launching of the CTeL AI Blue Ribbon Collaborative. This is something that we're really excited about because we've had 13 founding members across the fields of medicine, academia, science, technology, and law who are outside of CTeL, so they're not part of the membership. They are external experts who can really help serve as these kind of agnostic experts to help us understand this issue and hopefully be a resource for policymakers, especially as they continue to look at and create policy on AI over the coming year. And again, we'll be hosting our AI Health Showcase on March 12th, 2025, back at Capitol Hill. And so looking ahead into 2025, we will continue to expand upon our reach, growing membership, finding new opportunities to engage and really bring that value to you all as members. We are continuing to finalize some of our current research efforts, including looking at diversion when it comes to telemedicine prescribing, which we will hopefully use to help with our efforts to educate the DEA on this issue. We are also working to fund and produce updated cost impact research. This is critical because the Congressional Budget Office needs more data from post-2020 on the financial impact that telehealth has had so that it can properly score any sort of bill that would establish these flexibilities permanently. Currently, the CBO doesn't have enough data and they've put out a call for data. And so CTeL is looking to answer this call with high quality, independent academic research that we are seeking support from the community to fund as well. And we will also expand upon our service offerings to really help everyone in the field of digital health and ensure that we can be as much of a provider of agnostic and accurate information when it comes to telehealth, remote monitoring, AI, and other future technologies. So thank you all so much for joining. I'd be happy to take some questions or open it up to some general discussion.
Lydia, thank you so much for the overview. I think the pending question on everyone's mind right now, of course, is looking over the next 3 days instead of the past 362. What is CTeL's, I guess, feelings or hot gossip about what may transpire with the bill pending before Congress concerning the continuing resolution?
Yeah, for sure. This is definitely a fluid and evolving situation. And so, like I said, there's nothing that we can really guarantee or be 100% certain about. I'm putting a link in the chat to just one article talking about how there are some cracks in any coalition that would be needed to pass this bill out of the House. Part of the issue with this bill is that it's not just a continuing resolution to keep the government funding, but there are a lot of policy add-ons to it, including a lot of funding for disaster relief. There's a year extension of the farm bill included. There's also the PBM reforms have been pretty controversial as well and have gotten a lot of pushback from the PBM industry. And so what will really make or break this is whether or not Speaker Johnson can build a coalition around this bill. This coalition will likely need some pretty broad support from the Democratic Party. The issue of telehealth itself is very popular in Congress. I've attended all the hearings that Congress has had on this issue over the past year, and every bill that has come up, especially in the House committees, has passed unanimously with full support from members of both parties. And so telehealth itself is not a particularly controversial issue, but of course, because it's in this large spending package with a lot of policies that are a bit more controversial and have a lot less support from across the House in general, it will mainly depend on whether or not the policies included have enough support to make it over that finish line.
Thank you. Very comprehensive answer. Appreciate it.
And of course, CTeL will keep you all updated on this as we continue to learn more information. Just because this is, of course, coming right onto the deadline as Congress typically does, we will probably be on the edge of our seats until probably late in the day Friday. But we will make sure to keep you updated with anything that we find as well through this.
I was just curious if there's, kind of any kind of specifics about the data that OMB is looking for, kind of particularly with an eye toward hopefully a permanent extension of some of these things. Is it still mostly just looking to see if like it causes utilization to go up or, something like that, or?
Yeah, I can actually pull up, there's a slideshow that CBO made that specifically lists the data they need. I don't have it up right now, but I can pull it up in a minute. But basically, a lot of it has to do with the idea of substitution, like does telehealth substitute for services that would be normally done in person, or is it additive? Do people use telehealth and then go to see in person? Okay, I've got the link now. I can put it in the chat. It's a slideshow from the CBO. And then I believe it's on page slide 8 of that slideshow that I put in the chat. That kind of gives an overview of where 8 through the end of that slideshow kind of overviews the specific data that CBO wants. We also have a kind of brief on the specifics of what we're seeking from our research that we're doing. And I can put that in the chat as well, just an overview of the research that we are looking to have done as well. So I just put that in the chat as well, just kind of an overview of both what CBO wants and the model and the kind of research we're putting together to help address those questions.
Great, thank you.
Yep.
Lydia, the research that you were just talking about, does that tie into the specific calls to action that Dr. Chopra gave us at the fall summit?
Yeah, yeah, this is really our efforts to address some of these issues, because without it, CBO won't be able to properly score telehealth. What we saw in the past is that with existing data, a lot of the restrictions that come with telehealth reimbursement in Medicare, things like geographic site restrictions, came from a improper scoring by the CBO. And so because they scored it to be this widely expensive endeavor, Congress responded by putting a lot of the existing restrictions that we see on telehealth. And so what CBO wants, again, is data from post-2020 showing what the new patterns in telehealth utilization in the context of broader service utilization and cost impact as well. And so that's what we're really hoping to have by early next year. So that way we have enough time for CBO to accurately do the scoring, and then for Congress to pass the legislation as well before it expires.
Perfect, thank you.
And just to give an overview of some policies that we're currently looking at right now, we're drafting a comment letter on the new Medicare Advantage rule that was released a few weeks ago. One key piece of policy that's in that has to do with AI. And basically, CMS is proposing to clarify that any civil rights and equity statutes that apply to the administration of Medicare Advantage programs include those plans' use of AI. And so this is to address some issues that they have. For example, some AI systems that have been used in Medicare Advantage plans try to predict whether or not a patient would be a no-show to an appointment. And so kind of like what they do with airlines, if they predict that someone has a high likelihood of being a no-show, they'll actually double book the physician because that way they maximize the chances of actually getting the service in. But the algorithms that were used to determine that turned out to have a pretty significant racial bias that was really impactful in the kind of people specifically who that it was predicting would be no-shows due to larger issues beyond just being a no-show. And so CMS is responding to concerns like that by making very clear that civil rights statute apply to the use of AI in the administration of plans. So that's a pretty big one that we're currently working on a comment letter. I'd be happy to share some more information if you have any pieces you'd like us to add to that letter as well. And if you have any questions in the future, you're always more than welcome to reach out to me via email. My email, I'll put it in the chat, but it's just lydiah@ctel.org. I'm always happy to answer any questions you have or set up some time to chat. If there are no more additional questions, thank you all so much for joining us for this recap of CTeL's year, and we look forward to working with you all in 2025. Thank you so much.